Welcome back. This is Sleep Better TV. I'm Scott Drake, and my guest on the phone is Dr. Harvey Reiter, who practices dentistry in Las Cruces, New Mexico. Part of his area of practice is the treatment of sleep-breathing disorders. And sleep apnea, when someone is treated in your practice, for example, oftentimes they've been prescribed some sort of oral appliance. If someone is wearing dentures, how do you handle that?
It's a very difficult situation. Sometimes, if they have their lower teeth and they don't have the upper teeth, you can make a oral appliance, a sleep device, and it works as long as there's enough bone. They have good retention, and if you need to, I've made some. Sometimes you can make them over the dentures, but you're limiting your results with something like that. So in general, I would say if the patient's wearing dentures, unless they're retained by implants, they're not, the oral appliance is usually not going to work very well. But they do have something, there are other devices that will work in those instances.
I guess this might be an odd question, but how many teeth would one need to have in order to be fitted for an oral appliance?
Normally you're talking about eight solid teeth, maybe 10 sometimes, but 8 for sure, that are in good condition and they're good and solid. And getting back to just a little more information on that regarding that first question as far as wearing dentures. There are devices that they're called TRDs, or tongue retaining devices. It basically attaches to your tongue and pulls your tongue forward, because that's the idea of even the oral appliances is to pull the lower jaw and the tongue forward. Well, these devices will do the same thing. Some people can wear them, some people can't wear them. So, if you can't wear a CPAP and you don't have teeth, there's really no other choice, because sleep apnea needs to be handled.
And Dr. Reiter, if a patient has chronic gum disease, are you able to give them an oral appliance?
Yeah, it can. Not a problem. But the gum disease should be cleared up first. After it's cleared up and the teeth are solid enough, then there's no problem.
All right, Dr. Reiter, thank you again.
Thank you, Scott.
My guest has been Dr. Harvey Reiter. He practices dentistry in Las Cruces, New Mexico. I'm Scott Drake. Thanks for watching Sleep Better TV.